Hello friends, let us now learn some important points about the S-phase inhibitors. In the S-phase inhibitors, first we have anti-metabolites. Anti-metabolites in S-phase inhibitors include three types. One, we have folic acid analogues. These anti-metabolites include folic acid analogues, purine analogues, and also pyrimidine analogues. These can also include folic acid analogues, purine analogues, and pyrimidine analogues. Folic acid analogues include all these. These are not the folic acid analogues. Okay, first we will see purine analogues. Purine analogues are 6-mercaptopurine, 6-thioguanine, pentastatin, and cladribine are the purine analogues. Then we have pyrimidine analogues. Pyrimidine analogues are, before that, folic acid analogues are Methotrexate and Pemetrexed. Methotrexate and Pemetrexate are folic acid analogues. Pyrimidine analogues are 5-fluorouracil, cytarabine, and gemcitabine. 5-fluorouracil, cytarabine, and gemcitabine. In this class, we are going to learn about folic acid analogues. Folic acid analogues include, we have Methotrexate. Methotrexate, if you see, this Methotrexate will inhibit dihydrofolate. This Methotrexate or Pemetrexate are also called as Pralitexate. Methotrexate, Pemetrexate, or Pralitexate. So, Methotrexate will inhibit dihydrofolate reductase. This Methotrexate also inhibits thyramidate synthase. It inhibits thyramidate synthase, and it will also inhibit the enzymes which are involved in de novo purine synthesis. Methotrexate also inhibits the enzymes which are involved in de novo purine synthesis. Then Methotrexate will form polyglutamate inside the cells, and it helps to trap this Methotrexate inside the cells. It forms polyglutamate inside the cells and helps to trap the polyglutamate inside the cells, and thus it is cytotoxic to neoplastic cells. So if you see the uses, psoriasis is preferred. Then it can cause osteosarcoma, it is used in psoriasis, it is used in osteosarcoma, choriocarcinoma, abortions, non-Hodgkin's lymphoma, Crohn's disease, ectopic pregnancy, and rheumatoid arthritis. So these are the uses of the drug Methotrexate. Then if you see the pharmacokinetics, in pharmacokinetics this Methotrexate is sequestered in third space collection, and this Methotrexate reaches back into the general circulation and thus causes prolonged immunosuppression. This Methotrexate is sequestered in third space collection and it reaches back into the general circulation, thus causing prolonged immunosuppression. Now, if you see the clearance of this Methotrexate mainly depends upon the renal function. It also causes vigorous hydration is also required to prevent its crystallization in renal tubules. Vigorous hydration is required to prevent crystallization in renal tubules. So, if you see the next important thing, Pemetrexit. This Pemetrexate is preferred in mesothelioma. It is preferred in non-small cell lung cancer and breast cancer. Pemetrexate is preferred in mesothelioma, non-small cell lung cancer, and breast cancer. Then in osteosarcoma, we can use this Methotrexate, and along with Methotrexate, we can use the drugs in osteosarcoma regimen includes Methotrexate, cisplatin, ifosfamide, and doxorubicin is the regimen which is used in osteosarcoma. Then, if you see the side effects, side effects of folic acid analogues include, it causes bone marrow suppression, where Pemetrexed is more than Methotrexate. It causes prophylaxis For prophylaxis, because it causes bone marrow suppression because of folic acid deficiency. Methotrexate causes bone marrow suppression mainly due to the folic acid deficiency which is required in DNA synthesis. But now, in order to prevent this bone marrow suppression, we should give prophylaxis of leucovorin or folinic acid is added. Other side effects can be hepatotoxic, nephrotoxicity causing crystalluria, and thus this is contraindicated in renal failure. It causes nephrotoxicity, crystalluria, and contraindicated in renal failure. It causes megaloblastic anemia. Then we have Pemetrexit, which has hand-foot syndrome, which Pemetrexit, which causes hand-foot syndrome. This is painful erythema and swelling of palms and feet are seen due to Pemetrexit. This hand-foot syndrome is also seen in drugs like 5-fluorouracil, capsaicin, and it is also seen in Pemetrexed. Now, if you see the causes of methotrexate resistance, this is also important. According to the causes of methotrexate resistance, these include methotrexate resistance can occur because of decreased drug transport via the folate carrier protein. Whenever there is decreased drug transport via folate carrier protein, or if there is decreased drug accumulation intracellularly. It decreased drug accumulation intracellularly mainly due to the activation of MDR transporter P170 glycoprotein, or if there is increased level of dihydrofolate reductase enzyme, or if there is altered dihydrofolate reductase protein, and if there is whenever there is altered dihydrofolate reductase protein, this will decrease the affinity of methotrexate. See, methotrexate resistance can occur whenever there is decreased drug transport via folate carrier protein. Because of this carrier protein, there can be decreased drug transport. Sometimes there can be decreased accumulation of drug intracellularly, and there can be increased level of this enzyme dihydrofolate reductase enzyme. So, though methotrexate tries to inhibit it, because of increased amount of this enzyme, methotrexate action is decreased, or it can have altered dihydrofolate reductase protein, thus decreasing the affinity for methotrexate. So, this is about the drugs which are anti-metabolites. Thank you for watching.